Hello, everyone. Welcome to our webinar. My name is Tom Wolf. I'm a consultant. I've been doing some work with Tifa Research here in Nairobi on the Covid-19 pandemic here in Kenya. And I'm very happy today to welcome all of you who are watching and also especially the panelists for this discussion. I will give some background to the launch of this survey, of which there have been now 3 rounds at the end of April, and then in June, and then at the end of September into the first week of October in a moment. But first, I would like to give each of our very distinguished panelists a chance to briefly introduce themselves, who they are, what they do, and the main issues that they are going to address in the course of this webinar. So I guess ladies first, and Ellen, because you're the furthest away, why don't we start with you?
Thank you, and thank you for inviting me to join you today. I really appreciate it. My name is Ellen Lust. I'm a professor of political science and also the founding director at the Program on Governance and Local Development at Gothenburg University, initially founded in 2013 at Yale University. And we've been doing surveys on COVID in Kenya and Malawi, so I'll talk a little bit about the Malawi survey today, and also in Zambia. So that's, I look forward to this discussion.
But you've also done your own research in Kenya, so it's not completely a new environment or context for you. Yes, thank you, Caroline.
Hi, my name is Caroline Sakwa. I work at SHOFCO as the Chief Programs Officer. Basically, SHOFCO is an NGO that works in slum areas in informal settlements in Nairobi and in Kisumu and Mombasa. And basically, I'm here because we've done a lot of COVID response activities and implementation of a COVID response activity during this pandemic. I'm glad to be here.
Thank you very much. And third and last, Dr. David.
Yes, good morning, everyone. Good morning, Tom, and the other panelists. My name is David Ndii. I am here in Nairobi. I do economics and politics.
Thank you very much.
I am going to be talking about basically providing context with regard to the urban informal economy, how they work and what this data is telling us about the economics, as well as the socioeconomic of informal settlements. So just providing the context of how this data informs or what we're seeing is informed by what we know about how households of this nature cope with income and economic shocks. So that's going to be the gist of what I'm going to talk about.
Thank you very much. Before I invite our panelists to make their comments, as I said, let me give you a little bit of background to the survey. Back in March, which seems like ages ago, we here in Kenya were really holding our breaths as we saw this COVID-19 virus pandemic escalating in other parts of the world. And we were told it was just a matter of time before it arrived in Africa and in Kenya in particular. And we needed to try and figure out ways, both individually and collectively through government and also the private sector, what could be done to prepare the country for its arrival, which, as we all know, has occurred shortly thereafter. And in Kenya, as in other places all over the world, the government have been wrestling with this problem, a very serious problem, in many ways, certain ways unresolvable, as to how to strike a balance between public health measures that would protect citizens from the virus on the one hand, and also to allow for or protect a certain proportion of economic activity to go on so that people would be able to eat something at the end of each day. And as I know Dr. Ndii will point out, the particular situations of people in sub-Saharan Africa and some other parts of the developing world are quite similar in that a very large proportion of the public really does not have anything to eat at the end of each day unless they have some income during that day. So as we've just seen in the last 24 hours in France, a return to a major lockdown as COVID cases and hospitalizations and deaths are increasing greatly there. Other countries in Europe are also taking major steps, the UK and so on. People thought a month or two ago that this thing was beaten, but it's proved to be very, very resilient and unforgiving. That is the virus. So back in March, when this thing, as I said, was getting ready to come, I got in touch with Ms. Maggie Herreri, the CEO, founder of Tifa Research, with whom I'd worked before in another company. Our relations were quite good. And we put our heads together on this and decided we could provide some interesting research data if we managed to get enough funding to conduct these surveys about how COVID was impacting Kenyans. Now, because of limitations of the funding that we received, however useful it was, and the initial round was funded by Nation Media Group and the Hans Seidel Foundation, we decided, and not only because of funding, but also because we could see from what was happening elsewhere, especially in sub-Saharan Africa, that it was really the most vulnerable populations, that is, people living in the lower income areas of major cities, who are going to be most directly affected by this. So we designed this survey to target residents of Nairobi's low income areas and to explore these issues with the hope that we would be able to get enough additional funding to do one or more additional rounds of this survey with certain intervals. And so for our first round, based on the funding we had, we were able to interview 356 residents of these areas. And this was all done through mobile phones by the Tifa field team. They all did these interviews, they say, by phone, so they didn't have to physically expose themselves to the virus by going out. And fortunately, Tifa, based on many earlier surveys that were household-based, have collected a very big data bank of mobile phone numbers. So not just for Nairobi, but for really all parts of the country, it's possible to interview people without knocking on their doors. So that was done, as I said, round one in the latter part of April. And as I say, when we designed this idea, we wanted to both capture the immediate situation that our Nairobi low-income area residents were going through, but also, as I said, to do this over time so that we could track any changes that we found that they were experiencing, or changes in their views, whether about the danger, threat, perceived threat of the virus, or the role of private sector NGOs in delivering assistance, also government measures, the restrictions that were put in place, and how people were responding to those, including enforcement, the role of police, and so on. So we wanted to get, as I say, both immediate pictures of what was going on the ground at the time, and also to track trends as this very, very difficult situation evolved. And this was for different purposes. At one level, we hope that by releasing our results to the media, people who are in a position to make policy would be informed by some of these results. And that's actually a question that I'm going to throw at Caroline from Shofco in a moment, and that is how they put their programs into place. Did they have their own database? Have they been collecting their own data? Or is the kind of data that this Tifa multi-round survey is producing of additional use to them? But Caroline, just hold on for a minute. And then at another level, we hope this data would be useful to people wherever they are, whether at Gothenburg University in Sweden or anywhere else, in terms of sort of individual and collective behavior. How do people respond to such threats? And assuming, as we do, that most of the responses that we got from the people we interviewed are pretty reliable. We didn't see any questions that people would go out of their way to be deceptive or dishonest about. For example, we asked people how worried they are personally about getting infected. We've asked that question every time. And we gave them 4 choices: very worried, somewhat worried, only a little worried, or not worried at all. And we wanted to see, in terms of behavior, how these expressed levels of concern with personal infection relate to the kinds of personal protection measures that people were or were not taking, whether it's washing hands, whether it's keeping distance, and so on, especially for those measures that are not legally required from the government, for which you might be punished if you were caught disobeying. So, as I say, we wanted to explore both behavior and also kind of the mentality of people, and what was the relationship of perceived threats and so on to the variations in behavior that we found. In round 2, as I said, that was done in June. We had additional funding. Again, we had from Hans Seidel Foundation, but then the Canadian High Commission came in and they provided funding for both rounds 2 and 3. That allowed us to increase our sample size. So in round 2, we had 579 respondents, and in this last round 3, we had 555. And I could say that of those who were interviewed in the last round, 479 of them had been interviewed either in round 1 or round 2 or in both. Ideally, we would have liked to interview all the same people in all 3 rounds, because after interviewing them the first time, they basically know the questionnaire content, the subject matter is familiar to them, things go a little bit smoother in the interviews, but some people didn't pick their phones, some people were too busy and so on. So rounds 2 and rounds 3, in addition to wanting to have a larger sample size, we did have some people who were brand new to this survey. Hopefully we can find funding and have a round 4, and we have around 650 people that we've interviewed now at least once. So it would be quite easy to have a good robust sample. And I should also say, without getting into much methodological detail, that the larger your sample, whatever the margin of error is for those results, here it's about plus or minus 4%. When you want to look within the sample at particular subsamples, whether it's just based on a demographic like men versus women, or some of the reported behavioral issues that we track. For example, are you engaging in any prevention measures inside of your residential area or a household? Or for example, do you have a room in your house where somebody could self-isolate if they had to do that? We would like to be able to break down the sample into some of these subsample categories. And of course, when you do that, that subsample, the margin of errors for those go up because the base number is smaller. Ideally, we'd be interviewing 5 or 10,000 people, but for funding reasons, that's just not possible. Now, before I ask Caroline to begin, I want to give just a couple of questions to all 3 of our panelists to be thinking about, which they can decide to address or not when they start making their own presentations. And the first is, again, about the sample. When you look at the demographics that are included in each of these releases, based on what you know about Nairobi's low-income areas, does it appear to you that the respondents that we captured for the survey, in terms of their age, in terms of their education, in terms of their economic position, employment status, and so on, education level, I think I mentioned that, is there anything that jumps out at you that makes you question whether this sample really did represent the population that it purports to? And then second, to go back to something I said earlier, you could think about, aside from maybe your own work, what do you think would be the best uses for such data by particular actors or analysts? And are there any questions, or is there any subject matter that we left out that if we did a 4th or 5th or whatever round of the survey, that we should try to include? Keeping in mind, and I know all 3 of you understand, when you're doing mobile phone surveys, you really can't expect to have the attention of the respondent for more than 30, maximum maybe 40 minutes. People have other things to do. You don't know what's going on in the background. So you can't ask about everything. And some of the questions we asked in round 1, we had to cut out because we put in some new ones in round 2, and so on. For example, in round 1, we had a couple of questions on domestic violence and children's learning at home, but due to some interest from some of the recipients of the data, we added a few more questions on those in rounds 2 and 3, and we had to cut out a few from round. So this is just to give us advice and criticism as you're discussing the data that we've put out for our 3 rounds. And if people have other questions about methodology or plans moving forward, we can discuss that. Let me now hand things over to Ms. Caroline Sakwa from SHOFCO, Shining Hope for Communities. And I just wanted to mention to those who are watching that in our first round survey in April, we did ask the question as to whether respondents are aware of any organizations aside from government who are providing any assistance. And overall, we had about 70%, 65%, I think, who could not mention any. This overall figure had dropped by round 3 in September to only about 15 or 20%. I can check the figure in a moment. But SHOFCO Sorry, that went from 63% to 33% of those who could not mention any. And for Shofco in the first round, only 16% mentioned that they were aware that Shofco was on the ground in these areas doing useful work. And here we are 4 months later in September, end of September, that percentage who mentioned Shofco went up to 45%. And I can say that that was nearly 3 times as many as the next most frequently mentioned organization, which was the Red Cross at 16%. Now, this doesn't necessarily mean that what Shofco is doing is 3 times better than what the Red Cross is doing, but I think it's very impressive that this one organization had by far so many more mentions or recognition of our respondents than anybody else. And that's why we're so pleased to have Caroline with us today. So please, Caroline, welcome.
Thank you very much. On behalf of Shofco, in terms of presentation, yes, we have a monitoring and evaluation department and database kind of programming where we capture data with regards to the services and the activities we are implementing in the ground. And because Shofco is basically situated in informal settlements, we work in 17 informal settlements of slum areas in Kenya. That is Nairobi, Mombasa, and Kisumu. And in our presence is all felt in these slums because we provide essential services from education to health to water and sanitation. We are able to capture data through our M&D department and M&D staffs. We are able to analyze the data on a weekly basis that is shared to our bigger office in the US. Through that, we do analysis, and we are able to know how far we are reaching informal settlement dwellers with regards to the different services that we are offering in the Shofco. Yeah.
Thank you very much. Would you like to say anything in particular about any of the data that you've had a chance to look at from these surveys as it relates whether to, I mean, your organization, we already mentioned the recognition rate, but overall about this issue of assistance to needy people?
Okay, I can talk about we've been doing a lot of cash transfers directly to informal settlement vulnerable families. We have a big program that identifies vulnerable families within the informal settlements. And so we have a database of vulnerable families. And we work in partnership with other donors like Give Direct. And we've been able to give direct cash transfer to over thousands of households in all the slums in Kenya. And also we've been able to partner with other partners within Kenya and also in Nairobi to provide food for vulnerable families in the community. And through that, also, we immediately, COVID was announced as a pandemic. One thing that we went with in the community is the installation of handwashing stations. And through this, young people were able to get jobs and be able to sustain and support their families in providing their daily needs. So through a small stipend, so through all these interventions we've done and activities, we've been able to capture data with regards to that. So with regards to the data that you just shared, I think it's very clear. And if it's compared to the data that we already have in our offices and in our M&D database, we'll be able to justify that the data is well represented.
Okay, thank you. And I might just mention in connection with that, that in this third round, we did ask the question to our respondents whether they personally have received any cash, relief food, or masks. And as you can see, I think it's slide 31, 17% said that they had received some cash. We didn't find out how many times, how much cash it was. And that had been an increase of up from 4% in round 2 in June. Relief food, 15% of our respondents said they or their household had received any food, which was up from 11% in round 2. And finally, masks, 20%, which was an increase from 10% in round 2. In terms of knowing anybody else or any other households that have received any of these 3 types of assistance, 61% said they knew at least one other person or one other household that received some cash. 55% that received some relief food, somebody else, and 46% that received at least a mask or some masks. So there's obviously been an increase. I would be very interested, once we finish this webinar, to maybe have a longer discussion with you, is to see what other kinds of data that you've been able to collect for your work, both to compare with the data we have, but also to give us ideas in case we are fortunate enough to continue such surveys to see if we can't narrow down on some of these issues and explore in more detail the very important work that you're doing. So thank you very much for that. So next, let me turn things over to Dr. Ndii, as he said, to give us some microeconomic context, both for the situation in which our targeted population find themselves, and then to make any links that he cares to with the data that we were able to get from these surveys. Thank you, Dr. Ndii.
Okay, thank you, Tom. Let me start with a very sort of broad context. Early on, you recall at the outset of the pandemic, there was quite a lot of commentaries and people highlighting that urban informal settlements in developing countries, Africa, Asia, were probably the most vulnerable. That was a prognosis, that they were probably the most exposed. And there were lots of appeals. They said, because of the crowding, they can't social distance, that social distancing was really something only privileged people can do. So all sorts of things. So they were both exposed. The prognosis was that they were very highly exposed in terms of health because of the living conditions, and also exposed because of incomes on the economic side, because they don't have the sort of social safety nets, public social protection that we saw countries in Europe and elsewhere, and the US rolling out huge sort of welfare interventions, social protection interventions, using their already existing social protection mechanisms. So there was a lot of prognosis that perhaps there was a big disaster waiting to happen. It hasn't happened. And in fact, these data are telling us, farming what sometimes, that this hasn't turned out to be. In fact, so much so that not too long ago, there was controversy around BBC, I think, program, which reported trying to explain why it is that these predictions have not come true. And they said it's perhaps the opposite, that because of the crowded living conditions, that perhaps people had developed immunity to this virus on the basis of exposure to other coronaviruses, some very dodgy science. So that trying to rationalize why it is that this hadn't been the case. There was also an article I read not too long ago. It was published in The Nation. It was titled, Blazing the Trail, How Post-Slum Flattened the Curve. And this was the narrative of a very big informal settlement in Mombasa called Bangladesh, and how this informal settlement had actually taken control, imposed, sort of practiced the kind of measures that first panelist was talking about, and had actually been able to reduce not just the infection rate, which Mombasa was one of the first hotspots, but they had also actually seen, because of the public health interventions, they had also seen a reduction in other more sort of common public health problems like diarrhea in children and all of that. They actually confirmed that those public health measures were actually effective. And recently I saw in one of the briefings by the WHO, they do these regular briefings, and this was, I think, briefing number 25. And I'll just read what the WHO spokesman said, affirming the same thing. He said that Africa has many lessons to teach the world about how to be resilient and how to be creative. We need to look at the bottom-up approaches in Africa, the way responses are localized and communities participate. And I think that is really the problematic, that the prognosis, the hypothesis that urban informal settlements, they were really presented as helpless people without any agency and capacity to respond. And therefore, they only needed, they were sort of either going to sort of drop like flies, or unless somebody sort of did very huge interventions. And that hasn't turned out to be the case. Obviously, in the case of Africa, it's also the case that the pandemic hasn't sort of hit the continent has had, but that's part of the reason. One of the things which obviously you see in this data, which begins to answer those questions, is the high level of compliance with the public health preventive measures. I think I saw numbers in the order of 80% of the people are practicing 2 or 3 of the recommended measures. Definitely all of them are washing their hands much more frequently. They're wearing masks. They're avoiding crowded places. They're doing all the right things. Now, the simulations I have seen suggest that such high thresholds of compliance are actually quite effective in sort of bringing down what the epidemiologists call the reproductive number, the infection rate. That's exactly what you are looking for in terms of public health compliance. So they're doing it. They're complying. We are seeing it in this data, and therefore we can explain that the reason why there hasn't been the sort of devastation that was initially predicted is partly because these people have been more compliant. I find the contrast with some of the demonstrations I have seen in Europe and America, people demanding the right to not to wear masks, some even carrying firearms. I think that found to be quite a contrast. So clearly this pandemic is teaching us things. Now that's the health side. Now on the economic side, again, clearly you're talking about people with very low incomes. And from what we are seeing in this data as well, one of the big questions was how would they survive without huge amount of a huge public intervention, which many of us actually advocated. I was a very strong advocate of a fairly huge public intervention. To go back to the character of the urban informal economy and the informal economy generally, I wrote an op-ed quite early on, a bit tongue-in-cheek, because as soon as this happened, you saw a lot of middle-class people trooping to the informal settlements to provide arms. They sort of felt that the same sort of thing. And I wrote a bit of a tongue-in-cheek and told them, you guys, wage-earning middle-class people are actually more exposed risk-wise than the informal sector people. So you are actually more exposed than they are. And in fact, within a couple of weeks, you saw huge sort of springing up of what you might call sort of flea markets in Nairobi, where middle-class people are selling vegetables out of the back of their cars. But that's quite a contrast. Why? Now, for a very simple reason, which sounded quite counterintuitive to many people. Informal economy labor market is a flexible income wage economy. Where people work, it depends, your income depends on how much work you get. You don't have a salary of a fixed amount. So if you think about people who work in a hair salon or barber shop, if you cut 5 people's hair, you charge them 300 each. You pay 100 to the salon owner, you keep 200. So if it's 5 people, you make 1,000. If tomorrow only 2 customers turn up, you make 200. If no customer turn out, you make nothing. If you think of people who work in a car wash, you know, if it's very muddy, during the rainy season, there are lots of cars to wash. You make quite a bit of money. If there is no cars, then you don't make any money. So because people have highly variable incomes, what happens is that when the economy is down, when things are down, it is the income which goes down. But nobody loses their job, yeah, because you're not employed. You share the work which is there. So if there is little work, all of your incomes go down. If there's a lot of work, all your incomes go up. People who work in wage economies, what happens is instead of sharing the little work which is there, when there's little work, some people are fired, are laid off. So those who remain with high incomes, and those who are not lucky enough have zero. So in the informal economy, there's nobody who ends up with zero, because the work which is there is shared by all the people. And of course, when people work together, if I get work today and you don't, I can sort of share some of the money, and tomorrow you get work and I don't, you share some of the money. So there's an element of insurance, sort of mutual. What that often means is that informal economy people are used to income shocks. And they have coping mechanisms for income shock. So when wage earners are laid off, they are very traumatized. And they are the ones who actually don't know what to do next. But informal sector people, if they don't get customers for 3 days, they are not traumatized. They activate their coping mechanism. The other thing which is also significant is that, as many people know here, and again, an op-ed I wrote several years ago about urban sociology in Africa, got a bit of a resurgence because it was pointing out that as Africans, most of us are straddlers. In city, we have houses, but our home is in the village. So one of the things you saw when the pandemic came out, people are doing okay until the government imposed movement restrictions. And when the government imposed movement restrictions, there was a huge panic and huge outcry because the movement between urban and rural areas is a very significant, in fact, it's probably the most significant shock absorber. Resilience is the most important resilience dynamic. So if you've been following the informal sort of narratives, is that one of the things that has become very common is the vehicles which usually transport passengers to upcountry from between the cities in Nairobi, for instance, and go up country, because they are not transporting passengers. They have to carry fewer passengers. They are making up some of that income by transporting food parcels from the villages to the people in the urban areas. So there is where ordinarily it is urban households which send the money, remittances to the rural areas. During the pandemic, it is rural people who have been sending remittances to the urban area in the form of food. And this applies, you find the same way in both informal as well as even middle-class households. They say they have been actually sustained by their parents and their uncles sending them bananas and potatoes and maize every other week from the village.
Sorry, David, if I could interrupt you for one moment.
Yeah.
We did ask in the second round, asked in all three rounds, what's the main way that the pandemic has affected you, if it has? And in the second round, we found quite a few people who had said that the inability to go and visit their rural home was one of the major areas, as you just pointed out. People wanted to get access to food, those who have a shamba in a rural area, or at least other relatives from which they could go. So the dropping of those restrictions a couple of months ago for Nairobi and Mombasa, at least, had a major major form of relief for quite a few families. In fact, some of our people that we called, based on the phone numbers we had as Nairobi residents, were actually trapped up country at the time that travel restriction was imposed, and they couldn't get back. Some people in Nairobi had relatives or other visitors from a country who could not leave, at least without bribing the police. One other thing I wanted to say, and then please continue, going back to something you said a moment earlier, to underscore your point. In our first survey in April, only 5% of our sample were in regular wage employment, only 5%. And in round 3, statistically, it was the same, I think 7%. So the fact that these are residents from low-income areas, it doesn't mean that 100% of these households are in the informal economy, but as you were suggesting, the vast majority are. And then related to that, just one other thing I will say, that over the 3 rounds of the survey, we had in round 1, 50% who said that they were jobless and they had never worked before. This was down to 29% by June. For those who were jobless, but that's who had been doing some work before, that had dropped from 50% to 29%. Those who were employed or self-employed and were working part-time was only at 28% in April, but at the end of September, that had gone up to 57% as some of these restrictions were lifted. So there was a major increase there. However, with regard to income, when we asked how much income, for those who've been earning any, are you earning now compared to before the pandemic? In April, 56% said they were earning nothing of what they had been earning before, when all those first restrictions were in place, including the travel, extended night curfew, and so on. By the time we did our round 3 weeks ago, or a month ago now, that 56% of those who said they were earning nothing of what they earned before had dropped down to 15%. So even if I can agree with you that much of the nature of informal economic activity is much less dependent upon sort of macroeconomic activity and so on, the lifting of these restrictions and maybe the lower level of implementation or punishment for people who were doing things they weren't supposed to do over these 4 months has meant an increase in the proportion of our sample who are at least earning something. Although overall, finally, in round 1 in April, we had 84% who said that the pandemic, the measures, restrictions put in place had affected their lives a great deal. And that was exactly the same 3 months later. So the great majority of our respondents are earning at least a little more than what they were earning 3 months ago. But the negative impact on their overall income has still been quite profound. We've seen in some West African cities, I can't remember now just where, some, we can say, economic riots some months ago when restrictions were put in place. But as you pointed out, we really haven't had these events, demonstrations and so on taking place here. I will just stop my interruption by saying, if in response to the current spike in cases, and we've seen even in the last 24 hours, many health facilities now starting to get overwhelmed as their bed space for patient declines. If the government goes back to implement the kinds of restrictions we had in April or even more, what might happen? And I should say, just to end, when we finished our interviews on October 2nd, we had 725 reported deaths for Kenya as a whole. As of last evening on the news, that was up to 950 deaths. So we've had the biggest increase in the rate of fatalities in the last 1 month than we've had throughout these 7 or 8 months. So the story, sadly, is not yet over. Sorry for the interruption, but I thought to give a little context from the data might add a little bit of meat to the very useful bones that you've been providing us. Please continue.
Okay, thanks. I was actually coming around to concluding. If you recall, I don't know, you may not recall, but I was quite vociferous, suggesting to the government before that they should let people leave the cities before the pandemic actually hit. And the rationale for that, I thought was pretty obvious, that because we don't have a public social protection system, and the people who are really exposed in terms of income are urban people, if we allowed people to leave, those who have a rural safety net, and they were comfortable that they have a rural safety net, then you would do things. You would reduce the size of the number of people that you're targeting, that would be targeted by a public sort of intervention. But you would also reduce the congestion. So you close schools and you'd ask people, okay, we know that in Nairobi, for instance, if you come to Nairobi in December between Christmas and New Year, the population you usually have, probably less sometimes. People you can find that there's absolutely nobody in the city because people do go to the village. And I think that's a very sort of effective and powerful mechanism that could deal with the congestion, with all of that, and provide a social safety net, because the very absence of public welfare systems, obviously, and economies which have high income variability, extremely vulnerable to shocks, means that people do have developed coping mechanisms. And for me, I was surprised that then the government, you recall, I used to tease the government and talk about adopting monkey see, monkey do approach. You see what people are doing, country governments are doing in Sweden, and you do the same, despite the fact that, in fact, you don't have a Swedish welfare system, and your people probably don't need it either, because they have their own coping sort of mechanisms. So I think where this data is actually useful is validating that fact that if you pose the question, why have the initial predictions about what might happen in urban informal settlements in developing countries, why has it not materialized, both in terms of the health and economic impact is one. The data tells that in fact the level of compliance is much higher, and the capacity of these communities to exercise their own agency and take control. And you see it not just in the level of compliance, but the level of knowledge of the pandemic and what they need to do is extremely high. So obviously, I think partly the spread of information, communication technology, mobile phones, and all of that, I think that's extremely useful because those messages are getting to people. And the fact that there is communities, these communities are actually quite organized. They cope with adversity all the time. So organizing to deal with an adversity is the social capital, I think. There's quite a bit of social capital in these communities to be able to deal with the external shocks of this kind. Finally, I think the question of this sort of micro data would be very useful. Is you're obviously interviewing the same people. It would be interesting to find out how many people have actually left. Because my anecdotal information tells me that the level of actually migration, rural by people sort of migrating back to rural areas is actually quite high. So that as this second wave happens, I think the question of mobility is one that will have to be considered. So that this approach thinking that the way the lockdown is the trade-off between the people's capacity to cope with it. You've got a situation where you don't have a social protection system which is providing people with support in place, if they shelter in place. And then you impose lockdown on the people. So I think what it's telling us that we need to think about other ways of balancing the sheltering in place and also mitigating, not obliterating people's ways of mitigating the economic impact, precisely because you're not providing for them. You don't actually have the capacity to provide for that many people. And yet you're locking down their sort of coping mechanism. One of the reasons I think why you did not see the sort of riots that you're talking about in some of these places people do get it, is I think because even though there was a lockdown, the city is quite porous. I actually don't think it managed to stop that many people who wanted to leave. But basically, so I think the lessons, this data is useful. I think more work of this nature is useful, particularly if I think it's not easy to do more qualitative type probing with mobile phones, but that's a challenge for you in terms of designing a structure which tells us how are people coping, how are these rural-urban interactions sort of playing a role, and that sort of stuff. So let me stop there. Thank you.
Thank you very much, Dr. Ndii. That was plenty to digest. And I also, to underscore what you said, I had mentioned earlier that in round 3, of the 555 people interviewed, 479 had been interviewed before. I don't have the exact number in my head, but one of the reasons that we had to recruit nearly 100 new people for round 3 was that quite a number were no longer living in Nairobi because they did exactly what you said. They have relocated to rural areas where, wakiwa na njaa wanaenda nje kwa shamba tu. They just go outside of their places there, and hopefully there's something that's ready to harvest. So there has been, and we asked people who reported that they were no longer in Nairobi why they had left. Now, obviously the numbers are pretty small, so the error margins would be big statistically, but if that data is of any use to you, or anybody else who's accompanying us on this webinar, we could make that data available, even if it's only 20, 30, whatever people who have relocated, why they went back. There are many other things that you addressed, but I think I will leave that to the other panelists when we get to the discussion at the end, and also other participants who've been sending in some questions. Now, Dr. Lust, Ellen, before you begin, I would just like to refresh very briefly some figures about awareness of the COVID-19 issue itself. In round 1, only 2% of our respondents said they knew anyone who had tested positive. And that had gone up 5 times by round 3 to 10%. In round 1, only 1% knew of anybody who had died. Around 3, 10% did. And I should say that we asked people who said they knew such a person exactly how they know them. We didn't want them to know because some personality that was broadcast on the media. We wanted to make sure this was someone that they personally knew rather than a doctor or a university lecturer. We've had these sad cases that have received wide publicity. So these were personally known. And yet, despite the fact, over this 4-month period of the 3 rounds, we've seen an increase in awareness of how the disease, how the virus is affecting people. The level of personal concern as of the end of September, when we did round 3, had fallen so much. In round one, as I said, 71% were very worried about getting infected. At the end of September, that had fallen down to only 40%. The percent on the other side who said they were not worried at all, in April round one, it was only 10%. Round three, that had gone up to 37%. So as I say, at the same time, as people have a larger sort of information pool of people who are testing positive and even dying, their level of personal concern is dropping. Now, as I said at the beginning, that the October 2nd cutoff date was before this most recent spike. But let me invite you now to address the issues that you have been following in Kenya and Malawi, because at least what you indicated, a lot of this does have to do with personal behavior, which to a certain extent obviously reflects what's in people's minds about their knowledge and level of concern, how they interpret those facts or that information. So please, Ellen, welcome.
So thank you. I'm going to present this with a few slides because we'll also be talking about some of the exact comparisons between Malawi and Kenya. We've actually, just to give you a bit of background, and it segues nicely or fits nicely with the previous presentations, because one of the goals of the work that we're doing is to try to understand which types of communities are more resilient, which types of communities are better able to respond to the pandemic than others, understanding that a lot of the response is not just about national level governments and the kinds of strategies that they take, but also really thinking about the more locally rooted responses. What I'm going to present here is drawing a bit from the second Malawi COVID survey that we've done. We've now done 2 surveys in Malawi. We've done 1 in Zambia and are going into the field in the second, and we've partnered with Tifa to be able to put some questions and work with them on some of the data, which I'm very, very grateful to. The Malawi and Zambia and also in Kenya, what we're doing is we had a set of phone numbers that we had collected in 2019. We do what we call the Local Governance Performance Index. And that is a survey that is aimed at understanding really questions of participation, service provision, natures of authority and kinds of messaging and in various communities. So it's very clustered so that we can understand community measures, and it's very aimed at understanding behaviors and engagement. So various notions of governance that go beyond just the state. We had collected telephone numbers in the 2019 survey in the 3 countries in the hopes of going back actually in a few years to see how things had changed. But when COVID struck, we understood that we had an opportunity to provide information to, basically to key stakeholders in the country, to citizens, as well as to other donors about the ways in which people were responding and sort of the impact of COVID on individuals' lives. So we've gone back and we've done these surveys. And again, this is drawing from the survey in Malawi, where we had about 4,781 respondents. It was really end of August to the very beginning of October. So it covers about the same period as the Kenya survey that we have here. And just a few highlights of the things that we've sort of found, and that are not necessarily, these are not the only things that we can think about. But one thing that we asked in both countries, although slightly differently, was what kinds of measures are being taken inside your household. It shouldn't be surprising in a sense that the most common measures in all households were hand washing, right? And these were, what we were really trying to get at were what were sort of rules and sort of things that were instituted in the households. Again, the questions are asked slightly differently, but what we also, I think, can really see is that, for example, sanitizers are much more common and used in Nairobi. Of course, it's much more of an urban area than they are in Malawi. Masks are more used, for instance. So we were able to look at the differences in terms of the use and prevalence of the different sort of approaches at the household level. When we look at mask wearing here, I think that really Nairobi is very strikingly different than Malawi. Now, again, I want to be very, very clear. In the Malawi, we're looking at a sample that goes across the country. We did segment out to look at the more, sort of lower income Malawians and compare them with the Nairobi sample, since the Nairobi sample is informal settlements and therefore also lower income. It has some of the same types of economic structures that we were just hearing about. Actually, it's important and useful to note that our Malawi data bears out exactly what you were saying about the who's losing jobs, right? So who loses jobs in Malawi are those who are better educated, actually sort of in middle and sort of upper income in terms of the quartiles that we have. Whereas those who were already in informal sectors, as you mentioned, essentially don't lose jobs. They see some reduction, of course, in income, and they're, of course, much more likely to go hungry. But again, turning to what we see in terms of mask wearing and comparing it in Nairobi versus the Malawi sample, we see that there's a sort of, and I actually can't read without my glasses. So we get about 36% saying that most people in their areas are wearing masks in Nairobi, versus only about 19% in the Malawi sample, right? So, and then on the flip side, saying only a few of them are, or even no one, it's more than half of the sample in Malawi versus about 30% of the sample in Nairobi, right? So quite a big difference in terms of just that prevalence. When we think about, we also ask some questions about how people see the issues of the potential sort of, if you think of it as corruption, but the potentials for using sort of the aid and the COVID crisis to either increase their power or enrich themselves as politicians. We actually see quite a large difference in terms of the extent to which this sample is worried about it in Kenya versus the Malawi sample. So we see over 70% of those in Kenya say that they think that, or they worry that some politicians may use COVID-19 crisis to increase their power or authority or to enrich themselves. We saw 21% of the sample in Malawi saying that in our last survey, where we asked specifically about the Chakwera government. We also asked about the Mutharika government and found that 54% of them had believed it happened under that government. So obviously there was a drop after the Malawian elections, right, which were quite, I think, actually unique and historical in and of themselves. But we do see the overall still quite a significant difference that might be useful to think through in the Kenyan versus Malawian case. And another note on that, one might think that was because again, for a class difference or sort of an income difference in whether we're talking about the informal settlements versus not. But at least in Malawi, where we look at it, we see that it is true that there's a relationship between sort of individuals' class status or socioeconomic status and their concerns, but it goes in the opposite direction. So it's actually those who are better off, sort of better educated, et cetera, in Malawi who are more concerned that the politicians will be exploiting the sort of COVID-19 than vice versa. I suspect anecdotally that might be the same in Kenya, but it's worth, again, sort of noting that. We also, and I think this is useful to think through when we think about the issues of aid, right? So, when we've asked about whether or not people feel like they deserve aid, so we saw about 40% in the Nairobi sample, and we only have this now for Kenya, but we saw about 40% of those who sort of were asked if they've received aid had received it, right? Of those who haven't received aid in Kenya, in the Nairobi sample, we're looking at 93% who say that they actually feel like they deserve help, right? So it's an unfortunately large percentage who are not absent aid because they don't need it, but rather absent aid because they haven't received it. And then here's what I think is very tricky for those who are giving out assistance. And that is that about 44% think that either a few or many of those who did receive assistance needed it less than they need it themselves. And I want to be really clear. I don't think that this is necessarily sort of a picture that tells us that aid is going to the wrong people or that that's actually the case. I think what it tells us is the way in which aid can be very tricky, right? So, at this level, it's suggesting that people can feel left out or disadvantaged unfairly, even if they're not disadvantaged unfairly, right? So I think that we need to separate those two. We've also seen in previous work that there's a relationship between aid and whether or not it's seen as political corruption, which goes back a little bit to the last slide and how that's seen, but also just that, aid being given by a party you like may be seen as aid. Aid being given by a party that you don't like can be seen as corruption, or if you're talking about, sort of elections, et cetera, can be seen as vote buying. So I think that it gets to a question about how aid can be distributed in it and what sort of can be done to address some of the kind of the psychological and social impacts of aid that go beyond the actual assistance itself. Finally, a thought on optimism, and again, I think Tom has rightly noted that in these cases, the survey was taken before or implemented before the current spike, and that was at the time that we implemented it. Both Malawi and Kenya, you actually saw quite a few, a large percentage of the people thinking that the worst has passed, right? Basically 67% in Malawi, 63% in Kenya, no significant differences when it came to sort of socioeconomic status and other types of demographics that we might think would be impacted. Again, thinking about what that might mean suggests to me at least that we're, and I think not only in sub-Saharan Africa, but frankly elsewhere as well, that we're in this kind of roller coaster, right, where people are going to sort of, think that things are better, take a deep breath, and then, sort of the next time that we see a wave, I think it in a sense sort of hits even harder, right, because wait a second, I thought things were getting better and now they're getting worse. So I think that's something else to keep in mind and to think through. You asked us, Tom, to reflect a little bit on, both what can be useful and what can be, how this data can be used, but also what we can sort of look at. I think the earlier remarks really point to thinking a lot more about the kind of these rural-urban transfers and remittances and the migration patterns. I think those are key issues that could be incorporated. Interestingly enough, it would be worth thinking about whether it's ever useful to go beyond the Nairobi, kind of the Nairobi focus, right, and to draw in some of these other communities that we might be able to think through, or at least sort of the kind of the informal settlement focus. The other thing I think, again, is really, it gets to these questions that go beyond what individuals do, but really thinking about what are the community conditions that allow for resilience, right? So moving from individual to thinking of the community contexts and how those might differ, even within various informal settlements. There's actually, at least from some of the earlier work that we've done and work that I hope to actually continue, quite differences in Nairobi's informal settlements in terms of how the sort of actual governance takes place. So those are just some reflections on how things can be, other things that could be thought through in the future. And a final one, which is about along those lines, but thinking about what types of authorities or what types of messaging actually can be influential, right? So, we do a lot in terms of thinking about what types of authorities are people being punished by, or who's implementing and enforcing, but also to think about what types of authorities' messages are seen as legitimate, as credible, as informative. And there in the Malawi and Zambia work, we've done some work on looking at, for example, whether or not a district health official or a village head which is very powerful in the Malawian case, or a religious leader, were more able to get people to stay away from kind of large gatherings, of which religious gatherings are one of those. And we thought, in that case, religious authorities may have more of an impact. We're able to get them to sort of implement hand washing or stay at home. And interestingly there, we found that Malawians quite regardless of their other kind of socioeconomic backgrounds, et cetera, really thought that saw this as a health issue and saw the health officials as the most credible, even when it came to something like, staying away from large gatherings and including religious gatherings. So just some thoughts on that and what might be useful to think through. Finally, it would be remiss without sort of thanking our partners and Tifa for working with us on this, but also IPOR, the collaborators on the project, and staff that actually keeps us going, and the funding from the Swedish Research Council and the Swedish Research Council Formas, which have actually made this possible on our side. But also to let you know that I'm happy, of course, to answer any questions. That's our sort of email that we can be reached at. We also have a webpage with many more of the findings from the Malawi and Zambia work, in case you want to take a look at that and see if anything's useful. So again, thank you for inviting me and for this discussion. I found it really interesting so far.
Thank you very much, Ellen. I'm wondering, given that your Malawi sample was so nice and large, over 4,000, I wonder if you're in a position, or you would be in a position, or you've already disaggregated your rural and urban respondents, so that some of those results can be compared a little more directly with what we were able to get with our much more modest sample for Nairobi. Second, when you were speaking of personal prevention measures, at least for those which people are employing in public areas, I wondered if you would need to tell us, for example, mask wearing, not just what is an official regulation, but what's the de facto level of enforcement. I mean, we've also asked people in this third round survey whether they've been arrested or fined for being caught in public without a mask. We haven't released that data yet. We hope to in the next couple of days. But the fact it is that in Kenya, there's certain things you're supposed to do. We saw now yesterday in the news that the private minibus operators in Nairobi are threatening a strike next week because they cannot profitably run their businesses if they have so much seat spacing on their vehicles. And the government is still trying to insist that each vehicle only has, I'm not sure what it is, something like a third of the usual number of passengers in order to maintain this spatial distancing within vehicles. So what's on the book as far as these regulations are concerned, and what's the level of enforcement, will obviously have a kind of feedback effect on the behavior of the individuals that we interview. And maybe finally for you, Ellen, I'm wondering something that was raised earlier, the reliability of some of the data. I mean, when people generally like to be seen as good citizens, that they're doing what they're supposed to be doing. I know we had one finding about to what extent are people wearing masks, and we asked them, and it was very high. I can't remember, 80 or 90% when they're in public. And then we asked, but in your area, how much? And it was much lower. I can't remember exactly how much, but which might be true, but how willing are respondents in surveys like these that you and we have undertaken can be trusted to report negative findings about themselves? I mean, you have to ask people, when's the last time you stole something? I mean, you could be sure that it's going to be underreported. So it'd be good to track it maybe over time, but let's not worship the figures per se. And then finally, before I throw it back, there's something that came up, I think that you mentioned, and this would be really for Caroline, and that is, you spoke about the data you collect and how you determine what criteria you use in terms of who gets the kind of assistance that Shofco gives out. But do you need to track the change in their, or at least the household economic position, so that one family that was receiving aid last month, maybe next month won't get it because somebody got a job or was rehired or was put on part-time, is now back to full-time, and so on? So how much fine-tuning do you have to undertake to know who stays on your list of recipients? And then getting back also to something that Ellen said, I mean, nearly all these people in these areas, I'm sure, could be defined not just by themselves, but by any objective outsider as being in need, whether that's defined in terms of calorie intake per day or whatever it is. So when people say that, or 93% of those who didn't get any assistance say they deserve it also, I mean, does that kind of, given that your SHOFCO's capacity and the other organizations that are doing some of the things you're doing is definitely limited. You can't help everybody. I'm sure that requires you to make some very difficult choices. And I'm wondering if you follow up and ask any of the households that have received your aid, have they suffered any social punishment or even verbal abuse, especially because of our data, as Ellen pointed out, some of these people think that others who got aid were not as needy as they are. So have there been attempts to victimize any of your aid recipients by those who felt that they needed it more than the recipients did, and so on? I mean, these are very, very difficult, issues. And for you people who are on the ground, we're facing them through interviews at some distance. You're right there in their face. So these are just, I think, some of the things that came up. Now let me ask each of you if you want to respond. Let's start with Caroline, because she went first. And then if either Caroline or David raises anything about your presentation, Ellen, we can have the three of you go through before I read some of these questions that have come in. So Caroline, welcome to you again.
Thank you again. Just to react to the different presentations that have been made. Thank you, David, and thank you, Helen. On issue of course, issues of social distancing in informal settlements, it's still a challenge. And it has been a challenge since we started the COVID response activities. As we all know, like, informal settlements are really congested, and distance is an issue even inside the houses. So it's something we are still struggling with as we work in informal settlement. That's show for an art organization. And what we are insisting on and what messaging we are putting across is basically the people living in informal settlements to know that it's their health and it's their responsibility. And if at all they are able to adhere to the Ministry of Health guidelines, then the infection rates will be lower in the slum areas, as much as social distancing is a problem. So there's so much sensitization and involvement of the community leaders, especially the chiefs and local administrations, to work with community health workers and volunteers to ensure the constant messaging is passed across within the informal settlements. Then on issue of course, many businesses were affected in informal settlements. Many people were able to do their small businesses, but in terms of the economic and income, it was really affected because most of their businesses were affected, and especially majority of the informal dwellers work in industrial areas, like in other casual jobs. So much of their jobs were affected. But as you talked about coping mechanism, David, yes, in informal settlement, there are various coping mechanisms among the informal settlement dwellers. And of course, also issue of building resilience among them and bouncing back. It's easy because of the social assets they've built among themselves. They're used to that kind of hard life, and also bouncing back, it's always easy. So yeah, I wanted to mention that. And of course, the work that Tifa has done is very useful, especially now with organizations that are basically using data and just finding information in terms of research and data to inform evidence-based programming, whereby we are able to know this number of respondents say this and this number of respondents were able to give these ideas. So it takes us to the drawing board, and we are able to design programs that are really like not promoting dependency, but basically promoting issues of resiliency and recovery when it comes to dealing with pandemics. On Helen's presentation, yes, the issue of messaging is really key in terms of influencing people's behaviors and personal behaviors at home. And we've seen this through our hand washing stations. When we started very few hand washing stations in Kibera and Madare. But as we went to all the other informal settlements, we realized as we put the hand washing stations, also business owners and households were putting their own small hand washing stations outside their doors. That means they're changing behavior, they're changing attitude, and the messaging is creating impact in the community, and the communities are getting transformed. So in terms of comments about the criteria that we use to identify who gets what, as you said, the capacity may not be enough, but with the small capacity we have, we do vulnerability in the social index process, whereby we are able to identify different matrices that enables one to be and even to be considered for any kind of support within the informal settlements we work in. And so we work with a team on M&D experts, where we develop these vulnerability index. and we design matrices that maybe are able to say in a household we need to look for people living with disability, people living with terminal illnesses, people having children under 5 who are malnutrition, they need support. Like, we look at different kind of indexes and matrices to ensure that when the M&D team is able to verify then the kind of beneficiaries who need to benefit from any kind of aid, there's a justification behind that. And of course, like, for example, our aid, like, we provided food aid to almost 35,000 households in Kibera or across the slums. And we know these slums have over 300,000 in dwellers. Like, we can't provide to everyone. And of course, there've always been complaints that I deserve I deserve the support, but I didn't get, but other people got. So of course there'll always be complaints in the community, but what we ensure is to ensure that we choose the extremely vulnerable, the unseen, the invisible, vulnerable families, and also involvement of other stakeholders like the chief, the community leaders, and also groups within the informal settlements to enable us identify the vulnerable families. Some of the aspects and methodologies we've used to ensure we are identifying at least vulnerable families within the community. Thank you very much.
Thank you very much, Caroline. Dr. Ndii, any comments on what you've heard from others?
Yes, I can sort of, I'm quite curious to hear from Caroline, and I suspect that other sort of participants might as well. I mentioned this article I read talking about positive public health externalities of these interventions, particularly the sanitation type interventions, also reducing the incidence of other public health sort of infectious diseases, particularly diarrhea in children. That was, I also had the same comment made in another conversation I was having on totally different things. It was on competitiveness with a couple of governors, county governors, and I had the same thing from the county governor of Laikipia, that they have observed a reduction, sort of the mobility associated with the sort of public health issues. And quite a lot of innovation, as you are mentioning, of people coming up with these hand washing stations, including touchless ones and all sorts of things. And my question is whether you're able to sort of track that within the households that you support. What is the incidence of any evidence of other public health benefits, COVID prevention measures, other than reducing COVID infection, reducing other infectious diseases? A second thing, the sort of things we are talking about, I mean, since you've been there, you're there all along, whether you observed any of these other coping mechanisms that we're talking about, for instance, urban-rural migration and rural-urban remittances, whether in cash or in kind. And when we look at socioeconomic data generally in Kenya, and if you look at our household survey data, you see they collect quite a bit of data on how households cope with shocks. And whether besides your remittance, one of the big sort of coping mechanisms is actually intra-household transfers, sort of remittances from other households. I know I have given a huge amount of money over the last 6-7 months to people, probably upwards of sort of $10,000, just to help people, various people I'm associated with. So whether that is another significant, because we tend to look at these informal settlements and dwellers in isolation, but they are also members of our families and relatives and people who work with us. To what extent that you see that sort of sort of household, families, relatives, that sort of support infrastructure, because I think that's very important. I mean, this is one occasion we can then compare, because evaluate the effectiveness of that kind of mechanism vis-a-vis state sort of based welfare systems. And I'm quite curious to see whether they can validate some of the hypotheses we have that such mechanisms are actually more effective than state-based welfare systems. Then from Ellen, I'm just curious about whether we have any way of comparing the difference between the government interventions in Kenya and Malawi. Have governments responded differently, and whether that is evident in your data? Are we able to evaluate public policy responses and vis-a-vis using these sort of comparisons and how they impact on the outcomes and interact with people particularly in the informal settlements, if we are only able to compare informal settlements, given that's all what we have in terms of Kenyan data. So this is sort of the observations that I think.
On David's last or almost last point, we did ask people if they had received any cash transfers through mobile phone, as opposed to a bahasha or by hand, and we got 28%. That is more than 1/4 of our sample has said yes during this since the whole pandemic. And for the 28% who'd received any cash through their phones, we asked the source, and 18% of those said was from a relative or a friend. So you're absolutely correct that some of this is going on. Whether all of these people had such generous relatives or friends as you, we'll leave that aside for now, but it's obviously happening. I just wanted to add that. Okay, Ellen, sorry, please go ahead.
No, that's really interesting. So yeah, back to the question about comparisons and what we can make of them. You're absolutely right, Tom and David, to some extent. I think you're on the same path of sort of needing to look at the urban-rural as well as sort of the class differences. There we have the data to do it. Honestly, it slipped my mind. I didn't do it this way. We also ultimately have the data to really look at informality and formality of settlements. So we have the way that the survey in 2019 was done was we have an understanding of which it's GPS, right? It's geolocated data, so we know exactly where people are. That said, I'm a little bit worried about sort of we ask people whether they're in the same place as they were when they were interviewed the first time versus now. We're looking at if they're not there, then we ask them where they are, but then that data becomes much less precise than the original data. So I think there are some things we'll be able to make those comparisons with, some ways in which we'll be able to know where people are, but it's not as Tom was mentioning earlier, where you call a number because they used to be in an informal settlement, they're now not. So we have some of that takes place in the Malawi sample as well. The question about how much are things enforced and what are the policies and regulations, I think both of you are touching on that. Malawi has been much less sort of strict and stringent than Nairobi and Kenya has. And in fact, in Malawi, initially they tried to have a sort of institute a lockdown. This is under the previous president, and that failed. So it was actually taken to the courts. It had sort of engendered a set of opposition to it. We had a question in the last survey about, would you think that a lockdown could be necessary if things continue to get worse? And there's sort of more amenability to it, but certainly, and by no means such a sort of a preponderance of support for it that you would think that they would be able to implement it if they wanted to. So just the entire sort of the kind of ecosystem, if you will, and the regulations and the policies are very different in Malawi than they are in Kenya. And that said, I think that one of the ways in which we have found it very interesting, and I would love to hear more, also about sort of your experience on the ground in the settlements in Nairobi, is that we really have found quite a variation in terms of how many communities have decided to put in things like curfews or decided to institute certain regulations. So, we sort of have three levels of regulations, right? One which is national, and there we know Malawi and Kenya are very different, as Zambia is as well. A second one, which is about, whether or not a community has decided that within the community they're going to have a curfew, or within the community they're going to do different things. And then we've seen about half of the communities in Malawi have said at least that they've instituted something, right? And if you think about, especially some of these rural communities and how strong village heads can be, you can see how that can take place. And then in those cases, we also see quite a variation in regulations, in enforcement and in compliance. So it's not just that when we get to the very household things, and almost everybody says that everybody complies, right? So things made in the household, okay, this is a household decision to do X. At least they report compliance. Whether that's real or not is another question, Tom, I agree, but that's definitely sort of highly seen as compliant. Once it gets to the community, it's about half and half. It's much less expectation that everybody is complying with this sort of decision or regulation. which gets a little bit to the question about, and so can we use it, by the way, to, basically kind of investigate or interrogate how well has one policy worked versus another? I mean, I think this is actually a much broader discussion about thinking about what those counterfactuals would look like, sort of, because that's really what the question is, right? How much do you stop things from getting worse? And my two concerns with that, more broadly than just with regards to these two cases, is that, first of all, it's not over till it's over, right? So we don't really know. Some countries have looked like they've done very well, and then all of a sudden sort of fallen off a cliff. Others look like they're doing very badly, sort of, Sweden being an example of that. And then, others sort of catch up to them in a very bad way of catching up, right? So I don't know that we can actually make those kinds of comparisons, or that I would feel comfortable. I think we can certainly talk about, how much is compliance taking place, but the sort of the broader, do they do better? I worry about sort of what we know or don't know in order to decide that. But the final thing is this reliability of sort of how much do we think people are telling us what they think? And of course, to some extent, the fact that, it may be that we all overestimate. I mean, and if that's okay, it's okay if it's equal, right? If everybody overestimates something, that's not such a problem. It's a problem if some people feel like they need to obfuscate and other people feel like they need to, and there's something that's systematic about that, right? So, people who always, I don't know, more educated people always feel like they need to obfuscate, and less educated people don't think to, then we've got a problem in terms of making those comparisons. But we also have techniques, right, to try to get around this. So another thing that we did in the Kenya and Malawi cases, which I'd be very interested to know how you feel about it in Malawi and Zambia, and to know how you feel about it in Kenya, was that we were interested in thinking about these problems of stereotypes, right? So that people will start to decide that, it's the Tanzanians who have actually brought this into the country, or in Malawi, it was Indian who was one of Indian descent, who was one of the sort of first sets of cases. So associating the disease with a certain group of people, and creating kinds of negative stigmas and stereotypes about them. It's something that the broader kind of anthropological literature also shows happens much more generally than just with this. And so it's an interesting question about how do you get at that. And there we were able to do some experiments and show, okay, to what extent is it that people take an ambiguous case, somebody who's got a cough, do they all of a sudden decide that, if you're of the right group, that you don't have you don't have COVID, and if you're of the wrong group, you do. So we find that it's in that ambiguity that people will sort of unequally treat insiders and outsiders, right? Whereas kind of the clear-cut cases, they were quite clear that they would treat them all the same and saying, stay away from me, and sort of don't engage. So just some ways of thinking about how we can get over those reliability questions. I think we can definitely do it. And also we should be aware, like we talked about earlier, this is one form of evidence. It's one set of insights. There's a lot of others, and I think working together is when we can sort of come to the best understanding of what's taking place. So.
On David's input in terms of impact on public health, yes, SHOFCO runs 2 medical clinics, one in Kibera and one big one in Madare, in partnership with the Ministry of Health sub-counties. And we've seen reduction in diarrhea among children and also big people. And also there's reduced cases of upper respiratory illnesses. Like there's clear evidence that there's been reduction in those 2 kind of ailments within our clinic. So it means like nationally, of course, there's been evidence that there's the reduction on those kind of illnesses. That is diarrhea and upper respiratory illnesses. And also with regards to coping mechanism, we've seen immediately that many people have gone to the rural homes, especially when you talk about GBV and women who wanted to go to their rural homes and start all over again, maybe because of effects of domestic violence. We've seen a lot of urban-rural migration, and also we've seen a lot of rural-urban migration. Like we've seen people coming in, they're just waiting for the lockdown to be lifted for them to come in. Then there's also, we've done a small survey whereby we've seen a high number of people also indicating that some of their relatives who are not living in the informal settlements, some of their self-help groups within the informal settlements that have enabled them to get some money to either deal with their daily needs, cater for their children, school fees and all that. So we've seen also that kind of support from different people like relatives, families, and also self-help group when it comes to table banking, especially for women, and also small loans that have no interest. We've documented a lot of families that have taken those kind of support. Thank you.
Thank you very much. David, I want to also invite you to respond to whatever you would like to of the other two panelists. But again, something that just came up, there was reference to the Nairobi lockdown. And if I recall correctly, that went into effect the same day that it was announced, whereas the counties at the coast that were travel lockdown were given a day or two before they took effect. I don't know if either of you know why that was, what was the urgency about Nairobi. And there were many people that were shown during the period of the travel restrictions being interviewed on the streets by local media, where people were saying, inviting COVID to kill them rather than die from hunger. People were being most affected by some of the restrictions that were in place. But again, those are just issues, whether, as I mentioned earlier, the kind of restrictions being reimposed in France and UK, whether that would have to be contemplated, or is there a point at which that the reintroduction of those restrictions we had earlier, for at least the big cities, Nairobi and Mombasa, or maybe even more draconian, depending on what happens with the course of the virus. But Dr. Ndii, well, I'm looking at a couple of comments here where one follower, Mr. Guyo, he says he was actually involved in manning a roadblock during the travel restrictions and finds the discussion very interesting. He asked Dr. Ndii for advice, but I'm not sure whether he's asking you how to make those travel restrictions more effective, or whether the broader question as to whether there's any point in doing them. And then we have another question for Caroline, but Dr. Ndii, if you had any response to Ellen, what she had said, or what Caroline has just said, and then we'll come to this other question, please.
Not really. I think they were responding to my questions, and I think they were quite sort of effective. I mean, the issues that Ellen responding to, that the policy regimes in Kenya and Malawi are very different, and therefore I think over time it will be quite possible to then look at this as sort of doing policy evaluation. What is the impact of these different sort of policy regimes? I think we can look at these policy regimes as, I think Kenya is sort of ranked as one of the countries with a fairly sort of stringent policy regime. And at the other end is Tanzania with none at all. And then I think Malawi sounds like it's somewhere in between. So perhaps what I don't know is whether the outcomes in terms of impact on people. For instance, I mean, if you think about the Swedish case, the debate was all around as to whether Sweden, by just having a less stringent sort of regime than the neighbors, had then less negative, had benefited economically, was trading off economy and with COVID, and it's not clear. So I'm thinking in terms of that question. Obviously, we may not macro level, there are too many intervening variables, but I think at the household level, particularly if we are talking about comparable sort of socioeconomic environments, it would be interesting to see whether Kenya's most stringent regime has had better outcomes in terms of COVID infection, sort of flattening the curve, as they say, but more costly economically. While perhaps Tanzania's no regime has, we see whether did it have more sort of, so negative effect in terms of the pandemic, and perhaps less economic cost. So those are, and Malawi somewhere in between. I think that's the sense in which I'm thinking about how we can then begin to compare these trade-offs between the different countries, because that would then at least be able to sort of, we could then be able to say something to policymakers that what are the trade-offs. But I don't know whether we have the data. But I get the sense that, yeah, perhaps these are some of the sort of next steps in terms of using this sort of data for policy evaluation. And of course, I'm sort of quite happy to thanks Caroline for vindicating that some of the things that I was postulating are actually being observed in terms of, for instance, the positive externalities in other public health areas, as well as these sort of resilience mechanisms. I think those are some of the things I think quite clearly we are converging on some of these, what some of the important insights from these sort of data sets are.
One issue that also came up in terms of policy implications, a question that we've asked on all 3 rounds is what people expect is the most likely thing to happen if no more assistance from organizations, in this case like Shofka, are giving. And in all 3 rounds, the most frequent response has been an increase in crime. Now, we didn't ask, have you been a victim of crime during this period, and try to compare that with earlier data. But I'm reminded that when I was doing research at the coast in the late 70s, there was a strike by the largest workers in the largest hotel chain there, and they were all sacked. And a couple of months later, when new people had been employed, I visited one of these hotels, and I was talking to the staff about this, and they say they're terrified, especially when they work the late evening shifts, to go home at night because the former staff are lurking in bushes waiting to rob them because they're now, they're hungry. So even in a situation like that, the fear of personal security issue was very large, even just with one, limited sort of region in the country. But I hope, Caroline, you were encouraged from what Dr. Ndii said. I have one question here for you, Dr. Ndii, where Mr. Reteng is asking whether the, if and when, the Huduma number system is up and running, that infrastructure can have a positive impact on government policy relating to social welfare in the informal economy. And maybe, Caroline, the question can be asked to you as well. I don't know enough about the details of how this Huduma number system is going to work, but is there some relevance there in providing a more useful information about what's happening, at least in this targeted population of our surveys? Dr. Ndii?
I think we need to be careful about looking for these sort of technology, IT technology things as silver bullets, because the provision of social welfare, social protection, is first and foremost a question of money. You have to allocate the budget. And if you recall, I tried to lobby very hard and wrote an open letter to the president to suggest that this is how kind of money we need to provide for these sort of things. And it didn't happen. Although much more money than that here has been spent. If you look at the amounts have been spent, they are much more money than the figures I was suggesting. Then if you have the money, then the next question is about targeting. And of course, welfare targeting is a hugely problematic problem. How do you identify who is deserving and who isn't? And my own sense is that in our communities, in our kind of society, the most effective means of targeting is actually not household, but community level. Because communities have more information about themselves and they are vulnerable people than you could probably ever do with a database or card system or whatever technology, gadgetry. So if you look at the letter I wrote, I had suggested 2 levels. One, which was based on enterprises, because enterprises employ people, and therefore, if they laid off people, those are people who need assistance. And therefore, then the enterprise, the distribution system I had suggested was banks, by virtue of the fact that enterprises have they operate and they have payrolls and all sorts of things. And I actually don't think that there is any other better mechanism than using that, trying to replicate using public, whatever they are thinking about in a country where we have serious corruption problems, is probably something that I would not advise. The second one, I said, okay, for people in the informal settlements and rural areas, I think the best mechanism is community, something similar, which would operate at the highest level, probably at the ward or probably lower. And then you'd set up structures which have representation of religious leaders and other trusted people in the communities. And I think that's probably the best mechanism to identify and also to provide for just sovereignty of people. We are seeing quite a lot of agency at the community level. So I think if you provide communities with the resources, they will come up with different sort of types of interventions. And you can actually learn from that diversity of those interventions instead of a one-size-fits-all thing designed by bureaucrats. We have experience with those, and it's not a good one. But there is a huge resistance to trusting community to solve their own problems, I guess, because it makes bureaucrats irrelevant. So the bureaucrats and technology suppliers and all sorts of people who want to run these platforms and all sorts of things. I think it's a political economy question. But I think if you tell communities of be organized and you can hear your resources, do what's best for you, to me, that's the best solution.
Thank you. Ellen, as you make your maybe final comments, that's an issue which just has come up. And did you find in your national sample in Malawi that in fact people in rural areas have found it much easier to cope than people in urban areas, if that was something that you explored? Or if you found, as Dr. Ndii was suggesting earlier, some rush of movement from urban areas to rural areas, whatever the level of restrictions, just because people wanted to be closer to food sources? Or is the urban population in Malawi less endowed in terms of having rural land holdings that they can come home to? So if you want to answer that as we make final comments, and then we'll end with you, Caroline.
No, so one of the things that struck me when Dr. Ndii was talking was that we actually need to do more about looking at the sort of the rural migration and also the remittance issue. So we didn't ask about where they had gone to, or if they were going out to, going back home to stay or for sustenance, etc. Again, remembering that the kind of the whole lockdown and a lot of the situation in Nairobi and in Kenya is very different, right? So some of those same pressures are not as strong. That said, everybody, the same notion of having your sort of, I like the way you put it, where you have your house in the city and your home in the country. That definitely applies in Malawi, and so I think it's an important question to be looking at. We didn't find as strong of sort of rural-urban differences as you might expect. In fact, when we look at what were the sources of differences, we find quite a lot of regional differences, which might seem the same thing, but aren't really, right? So, we've definitely found, and what they were, for example, if we're talking about, prevalence of COVID or difficulties when some regions, the south in Malawi tends to be poor and less well endowed. It of course was where we were lacking, soap and sanitizer and ability to do hand washing. Was also on the trek from South Africa, so ended up having higher prevalence of cases, right? So the kind of, we found a lot of effects of geographical factors, the kinds that you might expect and would matter, much more than a simple kind of rural-urban story. So that was things we can look into more. We certainly haven't exploited everything that can be looked at with this data. We were most interested, of course, in using it to be able to help citizens and government and policymakers and others to know where sort of the different sets of kind of needs and pressure points were, particularly in the early period of the pandemic.
Thank you very much. Caroline, any final comment you'd like to make? Welcome.
Okay, from my end is I just want to concur with David saying that community have solutions to their own problems, and also if we invest so much on community-related solutions based, then we'll be able to tackle a lot of issues that are affecting our country or our slums and all that. So I'm really glad, and this has been a very informative session. Thank you so much.
Well, thanks to all of you, and for anyone who is watching now or will watch in the future. All of these releases from the 3 rounds of the survey will be, many of them already are, but will be the others on the Tifa website. And we welcome your input, whether we succeed in getting funding for additional rounds or not. Of course, as has been mentioned, and especially when I hear results from Malawi, I'm very envious of Ellen that we weren't able to, at least so far, get the funding that we could do some comparisons with some rural areas in Kenya that I think would shed a lot of light even on urban data. So let's see what we can do moving forward. And maybe just to end, I would say that at the end of the interviews for all 3 rounds, we asked the participants if they enjoyed the interview. And we got, in all 3 cases, either 98 or 99% who said they did enjoy it. And we also then finally asked them if we phoned them again for another round of the survey, would they be willing to participate? And again, we got 98 or 99%. Now, we made it very clear that Tifa is just a research agency. We're not SHOFCO. We're not the Kenya government. We're not in a position to bring food or cash or whatever. Of course, respondents did get a little bit of airtime for what they contributed in terms of their time of participating. But I think of my last 15 or 20 years of doing survey research, this was the most positive response that we've got. Sometimes people don't like questions about who they're going to vote for, or whether they think elections were free or fair, or whether they're expecting violence or things like. But I mean, this, you could see the level of appreciation from our survey respondents, that at least for a project like this, somebody was interested in what they've been going through. And I think that really came through very, very strongly. So we hope that we'll be in a position to continue with this, or maybe even other research companies may get on the bandwagon, as it were, and find some ways of pursuing these issues. Because sad as it is, the reality is we haven't seen the end of this terrible pandemic. We hope that the current surge in Kenya, at least, I don't know what's going on in Malawi at the moment, but things are not looking good here. We hope that things will improve. I know there's this big debate going on now about children going back to school after some kids are being infected, and even I think the headmaster or headmistress at one of the Mombasa schools died this week. So things are very worrisome, but if there's any contribution that this kind of research can contribute, we're thankful for that. And thank you again to our panelists, and whoever is out there in cyberspace. If you want to give them a round of applause, I'll give mine. Thank you very much.
Thank you very much. I enjoyed this. Thanks.
Thank you.
Thank you, and bye. So
Thank you.
And all the best, everyone. All the best in your work. Yeah, and Shofko, thank you very much for being there for people.
Thank you.
All right.
Great to see you.